September 21st, 2016, and today I'm going to be demonstrating trach care and trach suctioning. I'm going to start off by doing trach suctioning. I've entered my patient's room, got my bed up to a working height, verified my patient with name and date of birth, and I've also verified my orders. I've given my patient privacy, and I have a clean surface to work on. I'm going to go ahead and wash my hands, let my patient know what I'm going to be doing, and establish a sign that the patient can tell me that they need more oxygen or that they're in pain or something, either raising his hand or winking. He's going to raise his hand if he's not okay. And then I'm going to pre-oxygenate, hyperoxygenate my patient and place this towel over him to keep him clean. I'm going to make sure that my suction is working. I'm going to put it on 80 to 120. I'm just going to check that it's working, and it is right now. Okay, I'm going to go ahead and get started. Open it away from me. Ready. I'm going to drop this onto my sterile field. Okay. Now I'm going to take my non-dominant hand. And that's going to connect to the suction. So now I'm going to dirty this left hand by connecting it to suction. Okay. So that hand is now dirty. I'm going to make sure that it's working. And it is. Okay. So I'm going to tell my patient that I'm going to go ahead and suction. I'm going to take the oxygen away. Be sure not to touch the cannula. Go down about 5 inches or so. If he starts to cough, come back up in a swirling motion. Okay. And hyperoxygenate. We don't want to do that for more than about 10 seconds or so. I'm going to flush the line. Okay. You can go one more time. Take the oxygen away.
Oh, and I have also established a form of communication with my patient in case I need to stop. So we'll just raise his hand.
Okay. Reapply the oxygen. I'm going to clean my line one more time. Okay. And then that is all for that. I'm going to go ahead and turn my suction off. Okay. Then I'm going to turn my oxygen back down to normal for the patient, document how the patient handled the procedure, and then characteristics of any sputum that I got out. Okay, now I'm going to move into trach care. Wash my hands.
I'm just going to go ahead and measure the NG2. I'm going to start by going from the tip of his nose.
Okay. I'm going to verify my patient one more time. I'm going to verify my orders again, and then I'm going to explain to my patient what we're going to be doing. We're going to be taking your cannula out, cleaning it, and reinserting it. We're going to go ahead and turn his oxygen back up and hyperoxygenate him right now.
Lubricate the esophagus, and now I'm just going to go ahead and turn his nose down, or head down. I found the biggest nostril and then insert the air. Right, so I'm
going to open up my normal saline, pour some into both sections.
And once he gets to where he's coughing, I'm
going to open up my hydrogen peroxide, pour it just into one section, mix it half and half with the normal saline or whatever your facility's protocol is for that. This is my new dressing. I'm going to save that. Be sure not to get it dirty. These are ties. I'm not going to use them for this video. Okay. Alright. I'm going to tell my patient that I'm going to go ahead and take the inner
So then
cannula
I would go
out.
ahead and document how my patient's tolerated and all that. Before,
Reapply the
immediately
oxygen.
after, I would do a couple tests.
I'm going to let it soak for just a minute in the hydrogen peroxide normal saline mix. And I'm going to go ahead and clean it.
I could also insert 20 milliliters of air and listen to the whooshing sound of the stomach with my stethoscope. But the definitive is to have an x-ray, abdominal
And
x-ray.
rinse it in the normal saline.
So after doing all that, I was
And I'm going to set it to the side to dry.
So there's that.
Okay.
And
So I'm going to,
so I have gone ahead and double checked my
do that
meds.
just yet.
My 5 right
going to pretend that this is already dry.
I went
And I'm
ahead
gonna
and crushed my
reinsert
meds
the
and
cannula.
added normal saline per hospital facility. And then I've also got a couple
Make
of
sure
normal
that I
saline
hear
there to
click.
flush.
Okay, and I
So
did.
wash my hands.
I'm going to put the oxygen back on and let them know that now I'm going to be taking the oxygen away for just a minute. So I'm going to give him about a minute to hyperoxygenate for that. And I'm going to be changing his gauze and cleaning his site. Okay, so I'm going to take his oxygen away. I'm going to undo the collar. Make sure to hold the trach in place,
So
not
go
letting go
ahead
of it.
and get a syringe. Put this in here.
I'm going to take
And
my
then I'm just
Q-tip
going to go ahead and flush
I'm
it. So
gonna
I'm going to
clean
draw 20 mils of
underneath
water,
the trach,
normal saline.
all around. Allow for it to dry, and I'm gonna
And then
note
I'm
the
gonna get rid of that
skin,
air.
make sure that there's no
So I don't
breakdown or
want the air in his
anything.
stomach.
Give him a little bit of oxygen right now while it's
From
drying.
there, I would go ahead and, sir, I'm going to be inserting some saline, okay?
Okay, and then I'm gonna put
Insert
new
the
gauze
normal
on.
saline. Sorry. Then I would go ahead and draw up my medicine. Trying to get as much medicine in there as possible. And then again,
Okay,
I'm
I'm
just
gonna
going to
give
go
him some
ahead and
oxygen
push
back
off
and adjust that
air
gauze
so
to make
don't
it
put
look
air
really
in his
nice and
stomach.
pretty. Okay. And then that would be changing all of that.
Okay,
I
now
would
we're gonna insert
decrease
the
his
med, okay?
oxygen down to normal
And then
once
I
his
would press the
saturation
med.
is within normal limits. Then I would document how
After
the
that,
patient handled the procedure.
I'm going to
I'm going to lower his bed back down to a safe position and do a
flush it
safety
again.
check before I
So
leave.
I'd do normal